So many of you, I've prescribed doing a 90-90 hip lift. And this is an exercise that takes into account your rib cage positioning, your breath, and really positioning your pelvis to allow you to compress areas that are not usually compressed in your body and expand areas that are not usually expanded. All right, our body, and especially our trunk, our systems, we have systems that really work off of pressure gradients. All right, energy, water, fluid, air will all go from a high pressure gradient into a low pressure gradient. All right, areas that are compressed in our body are higher pressure gradient areas, and will shunt air into areas that are more expanded, lower pressure gradient areas. All right, and often we see this in patients that have scoliosis, where they have a rotation of the spine and of the vertebrae and also the rib cage, which tend to have a right rotation to them, and a right thoracic scoliosis is often seen either as a primary curvature, where your right upper half is shifted more to the right side and your ribs are rotated to the left. You may also have a left primary lumbar thoracic scoliosis, where you still have a little bit of that rotation to the right on the upper half, but you have your lower body, which is pulling you more to that left-hand side and shifting your upper body over to the left, okay, with your hips to the right. All right, so when we try to teach you some exercises, all we're trying to do is trying to line up these blocks of the rib cage, the shoulders, the pelvis, and the hips, and really try to allow you to create pressure and high pressure in areas that are usually low pressure, and then also try to teach you to expand and compress areas that are not usually compressed. All right, so we're trying to switch the gradient upon which air is being positioned in the body from high pressure areas to low pressure areas and low pressure areas to high pressure areas. All right, and to do this, it's often nice to look at the model of the thoracic cavity here with the rib. And so in a patient with a right thoracic scoliosis and lumbar, you're going to see the rib cage rotated back into the right, okay? Compressed on that right side, and if you notice, you'll have a little bit of a flare on that left side. So we have an area on the right here that is more compressed, and we have an area on the left that is more expanded. So when we're doing this exercise of a 90-90 hip lift or laying on your side, we're trying to really work at trying to get this right rib cage expanded and trying to get this left rib cage compressed. So what we're trying to do is we're trying to take and switch this around. We're trying to use our breath and contract our deep abdominals on that left side to compress this area and expand on the right as we inhale, okay, to allow areas that are normally compressed to be expanded and areas that are normally expanded to be compressed. And not only do we want to expand this right rib cage, okay, but we also want to expand back, because we often, as we go into that right rotation, we also have to extend the back to do that. And that even makes that left rib cage a little bit more prominent and expanded. So as we compress this left side, we don't just want to try and arch our back backwards, but we really want to use that air as we breathe in and lock down this area here to shunt air to the right and also back, and allow as much expansion to the back as possible, going from a globally extended position into a more flexed position, biasing the left side. Okay, when we look at the hips, okay, we have somebody, a pelvis here, and somebody with, everybody has asymmetries, but in particularly patients with scoliosis tend to have more of a kind of blatant and obvious asymmetry than others. And often in patients that we have that right thoracic curvature, you'll also see your upper body going to the right, but you'll also see where your lower body, your lumbar vertebrae and your pelvis are going to be rotating to the left. So your rib cage is coming to the right, while your pelvis and your lower vertebrae are going to the left together. So we're getting some sort of, we call dissociation or rotation in the vertebrae and in the soft tissues, all rotate as a counter curve going to the left. All right, and this happens as our spine twists. We tend to see displacement of these curvatures as well, and that's where you see more of the Cobb angle, where you're getting these lateral deviations of the spine. So it's not just coming out, but we're also seeing a lot of rotation, and that's the primary thing that we see. So that's with a right thoracic curvature, primary curve, where your right rib cage is rotated to the right, and your pelvis and your lumbar spine are rotated to the left. But then it happens a little bit differently in somebody with a left lumbar primary curve, could be on the right, is where we still see a little bit of this rotation normally to the right with this rib cage. But in this sense, our body, because of that left lumbar curvature, these vertebrae are actually rotated to the left, and your pelvis will go with the rib cage to the right. All right, so we have the front vertebrae rotating to the left, but our pelvis decides to stay with the rib cage and come to the right as a balancing act, to try and allow our body to function as best as possible. And it's really just a compensation, and just shows you how efficient our body is at compensating for things when they happen. But the more important thing on this curvature, and when you have this lumbar, if you see here, normally on that other description where the right thoracic area is primary, the lumbar vertebrae and the pelvis, they go together. All right, so they're in harmony. But what we see here in the lumbar primary is our lumbar vertebrae start to rotate and angle in different directions to the left, but our pelvis goes to the right. And what we see often is a stretching, or something has to happen in order for those to dissociate and kind of go different directions. And it usually comes at the cost of having some laxity in the ligaments that control that right side, the QL, the iliolumbar ligament, that really control that the integrity to that area is lost. So during our exam, we'll also notice during that curvature that they have a lot of laxity in those areas of the spine. And it's of the utmost importance to try and maintain that integrity of this area and try and keep our lumbar spine and our pelvis in as best harmony as possible along with our rib cage. And that's why we have you doing some of these exercises that involve breath work, that involve contracting areas, again, that are not usually contracted and are more expanded. So we're compressing areas and then expanding others, and using our breath in particular to really help calm the nervous system down and try to allow some softening and getting out of this extended position, calming the body, and getting down to a position of much more efficiency at managing the different pressures and positions of your body system. So I hope this was helpful, but in particularly, the whole goal here is to really help position your rib cage, your trunk, and your pelvis in the best position possible, because that really inherently controls what our legs, our arms, and our head are going to do. But again, everything works together, and that's why a lot of these exercises will have you do a couple things together, because sometimes when you just work one area, it doesn't automatically fix the other area. Sometimes it does, but often it doesn't. So we try and do as much together as possible, because that's what we do when we walk, when we run, when we throw. Our lower half is always working with our upper half, and we want to make them in the best position and harmony as possible. Thank you.